I will talk a little bit about the research that I do on electromagnetic pollution, different forms of electromagnetic radiation, and how it affects human health. I will talk about two parts of the electromagnetic spectrum, dirty electricity, which is an intermediate frequency, and microwave radiation. And I think both of these are becoming very serious problems in the environment. And we know that they're adversely affecting human health. I also am beginning to do research on the healing effects of electromagnetic energy. And I don't think I'll have time to mention that here, but I might be able to just show you one example that I think is very important. What I would like to do is start with some of the research I did of how I became involved in dirty electricity. Most people don't even know what dirty electricity is, and when I started this research back in the early 2000s, I didn't know that dirty electricity can affect human health. I was very skeptical about it. And I got involved in this study because a mother called me in Toronto, and she told me that her daughter was electrically sensitive and had started going to a new school and became very sick at that school. And she told me she thought the problem was the power quality in the school, or the dirty electricity in the school, and that she had filters that she used at home that helped her daughter's health, protected her daughter's health. And she got permission from the principal to put these filters into the school environment to help her daughter. And she said the reason she was contacting me was to see if I was interested in doing research on the health effects of dirty electricity. And when she told me that she had filters that you can plug into an electrical outlet and that they would benefit human health, I was very skeptical. I didn't think that this would work. And I agreed to do the study because as a scientist, it doesn't matter what the outcome is. You ask a question, you design an experiment, and then you see what the results are. And so I agreed to do the study. We found that in the school that we were working in, we asked teachers to complete a questionnaire about their own health and to complete a questionnaire about student behavior, how the students were doing in the classroom. And we did this initially in Toronto. When the results came back and I analyzed them, they were so dramatic that I thought that I had actually made a mistake in the analysis. And I repeated the analysis a few times and realized that a very high percentage of the teachers, their health improved when we cleaned up the electromagnetic environment in their school. So we repeated the research at 3 other schools in Minnesota to see if we would get the same results. And what I will show you is just an introduction to some of that research. In Toronto, during the period when we cleaned up the dirty electricity in the school, 45% of the teachers' health energy level improved. They were feeling much better. In Minnesota, the percentage was 34%. So a very large percentage of the teachers were benefiting when they weren't exposed to the dirty electricity. This was very interesting research because at the time, we believed that 3% of the population was electrically sensitive. And so out of a school of 100 teachers, if 3%, 3 teachers improved, that would show us something that we were expecting. So we had a much larger reaction. They had fewer headaches. They weren't as depressed. They weren't as dizzy. If they had symptoms of asthma, the symptoms disappeared. They were able to think clearly. They weren't as anxious. They had much more energy. They weren't frustrated. So a lot of different changes in individual teachers. For the students, we found both in Toronto and in Minnesota, we found that student behavior improved in a very large percentage of the classrooms. And many of the symptoms that we were looking at from a behavioral perspective were the symptoms that we associate with attention deficit disorder, which is becoming a very serious problem in North America, with more and more children having it. And they're prescribed Ritalin so that they can behave normally. The results were much more dramatic in the younger children who were in elementary school up to grade 5, grade 6, which is about 11 or 10, 12 years old. In high school, the students didn't improve nearly so much. And we were trying to figure out why there would be this difference. And we know that younger children are much more sensitive to toxicants in the environment. So that could be one reason. The other reason could be that the high school students, when we did the study, already had cell phones. And so they were exposed to microwave radiation that we did nothing about. The elementary students weren't exposed to that. So that was the first study that got me involved in this. This is the list of the symptoms here that people were experiencing. The results in green were significantly better. The results in red were significantly worse for the period of when we had filters installed versus when we had a dirty environment. And if the dirty electricity had no biological response, you would expect the same number here getting sick as you would expect the same number here getting better. So overall, the symptoms, some of the symptoms are here: fatigue, dizziness, headaches, memory problems. And overall, the symptoms improved for 66% of the different things that we measured. So that was a very large improvement as well. There was another study that was done in a school in Wisconsin that had sick building syndrome. And they initially went into the school and cleaned up the mold, cleaned up the chemicals, removed carpets, got rid of the cleaning fluids that they were using. And the teachers, after this, a lot of money was spent in cleaning up the environment. The teachers went back to school, the students came back, and they were sick again. So it wasn't mold, it wasn't chemicals. And then they looked at the power quality in the school, and they found that it was very bad. And this is common in most buildings in areas that are developed. So it's a problem in your home, it's a problem in your office environment, it's a problem at universities, it's a problem at hospitals. And so they put in filters, they cleaned up the dirty electricity, and both the students and the teachers improved enormously after that happened. According to the school nurse who kept a record of what people were feeling, she said the staff had fewer allergies, the students didn't have migraine headaches anymore, but the most amazing result was what happened with asthma. At the school, 37 of the students had asthma and required the use of inhalers every day. And so the school nurse would make a record as to when they took their treatment. When the dirty electricity was improved, only 3 of the students used their inhalers, and only when they exercised, for exercise-induced asthma. Now, these students were still using their inhalers at home. And the way they found out that this change had taken place is the parents would buy the prescription, get the prescription for the inhalers. And they would contact the school nurse and say, does Johnny need his prescription filled? And the nurse would go to her records and she said, well, Johnny hasn't been using his inhaler for over 2 weeks. So then she went back through everyone's records, and that's when she came up with these results. So in a sense, that was like a blind study that was being done. The next example I have connects dirty electricity with cancer. There was a school in California where there was a very high percentage of the teachers who were developing cancer, and they thought there might be a cancer cluster in that environment. And so they measured for chemicals, they measured for low-frequency magnetic fields, and none of the results that they got could explain the cancer risk. And so Dr. Sam Milham, who is a medical doctor and involved in public health and an epidemiologist who does research on the harmful effects of electromagnetic energy, suggested that they measure the power quality in the school, the amount of dirty electricity. When they did this test, they found that there were 13 classrooms that had very high levels of dirty electricity, greater than 2,000 units on a meter that's available. And when they looked at the teachers who taught in those classrooms, if they ever taught in the classroom during their professional career, they had a 410% increase in relative risk of cancer. If they never taught in one of those classrooms, it was still elevated. It was still 80% higher than the reference population. So being in a classroom with dirty electricity, we think actually stimulates the growth of cancer, interferes with your immune system, and that's why there is an increase. If we look at the types of cancers that they found, one was thyroid. We know that thyroid is very, very sensitive to any form of radiation, particularly ionizing radiation. There was a skin cancer increase as well. This is statistically significant and very high. And cancer of the uterus. Those were the three cancers that had the highest increase with exposure to dirty electricity. Now the question is, what is dirty electricity? And one of the ways that I feel I can explain it is to show you pictures of what it looks like. If you think of electricity, it comes in a sine wave. And there are, here in Europe, there are 50 cycles per second. That's the frequency of the electricity you use. So it would look something like this. That goes into your computer, and your computer has microprocessors, it has different conversions, and it comes out looking like this. It is contaminated with other frequencies, so it's no longer a pure 50 hertz sine wave. The more contamination there is, the worse the power quality. And so this is one way of looking at dirty electricity. And there are many things that generate it. Plasma TVs is one of the worst. Compact fluorescent light bulbs, the energy efficient light bulbs that we're asked to buy, are very bad. Dimmer switches. But you can see here a list of some of the things that tend to produce dirty electricity. And even if you don't have these devices in your home, if your neighbors have them, it can come into your home through the electrical system because we're all connected through electricity. And even if you have power lines where you have trees touching it, every single time there's a touch, it puts a spike on the line, and that gets transmitted as well. So there's a lot of things that produce dirty electricity. There are two ways of measuring it. One is with a scope meter, and you can actually look at the frequencies, you can calculate the frequencies, you know how intense it is, or you can use a very simple meter that just gives you a number and integrates all of that information. So basically what this meter tells you is the amount of energy that is going along the wire that is above your 50 hertz. So high frequency energy is what this meter tells us. Now, we have done work with different people who are exposed to dirty electricity. And one of the things I was told when I first became involved in this, I met the person who produces filters, and his name is Dave Stetzer. He's in the audience in the back. When I first did the study at the school in Toronto, I was so amazed at the results that I wanted to meet the person who had designed the filters. And he invited me to visit him. And so I spent about a week to 10 days going to his place to learning from him what he was actually doing in this field. And as we were driving around and he was showing me the work he was doing on farms with other problems, he told me that it affects diabetics, that dirty electricity affects diabetics, and you can see changes in blood sugar. So I got very interested in this because as a scientist, you want to have numbers. You don't want to have someone say, I think my headache is very bad today, because you can't test if they're telling you the truth. You can't compare them to another person. It requires, type 1 diabetes requires medication, so very often they have to take insulin. And a very small percentage of all diabetics have type 1 diabetes. The other type of diabetes is adult onset or type 2 diabetes that accounts for 90 to 95% of all diabetics. And we know that especially this type of diabetes is increasing in our population, and we think it has to do with obesity and lifestyle. I think there's a third type of diabetes, And I call it environmental diabetes, where the trigger is something in the environment. At this stage, we do not know how many people, how many diabetics have type 3 diabetes, but it might be anywhere from 5 to 30% of the diabetic population. And in this particular example, it's an environmental trigger that causes the blood sugar to either go up or to go down. And the people that we've been working with, we can measure a change within 20 to 30 minutes. So it's very, very fast. I'm going to show you some examples of diabetics and how it affects their blood sugar. This is a 54-year-old male, and this is the dirty electricity in his home, and this is his first blood sugar measurement in the morning. So his fasting plasma glucose level. And we know that the level should be close to this line here. So if it's much higher than this line, that's an example of someone who's diabetic. And this is what happened. He would measure his blood sugar, and he would measure the amount of dirty electricity in his environment. And you can see there's almost a perfect linear relationship. So for this person, he has to have levels of dirty electricity that are probably less than about 25 units in his environment. One morning he woke up and he went to the computer right away, and this was his blood sugar. So it didn't fit the norm. It didn't fit the line. And he realized he was on the computer, so he moved away from the computer and he measured his blood sugar 10 minutes later. And this is how much it had come down. This is a very significant change in blood sugar over a very short period of time. What's lovely about this is that we can actually, if there is someone who's diabetic who is also electrically sensitive, then simply by exposing them to something that causes their blood sugar to go up, or exposing them to a clean environment can bring their blood sugar down, and we can measure this within half an hour. So this could be one way of determining which diabetics are also electrically hypersensitive, and it's something that can be done in a clinical environment. Here's another example. This is a person who is a type 2 diabetic. They take no insulin, no medication. They regulate their blood sugar through changes in their diet and through exercise. And the exercise of choice for this person is walking. So when she walks, if she goes for a 20-minute walk, this is an example of what happens. This is her blood sugar to start with, and this is her blood sugar after a 20-minute walk. And it's very repeatable. This is what you would expect if you were a physician recommending your patient go for a walk. There are certain days that she didn't feel like going outside, maybe the weather was bad, and so she exercised on a treadmill. And this is what happened to her blood sugar. Not what you would expect. And many doctors, because they're unaware of electrical sensitivity, when they have patients, they tell them to exercise. If that patient is also electrically sensitive and they're exercising on equipment that's producing something that's bad for them, they are actually doing themselves more damage by exercising on the equipment. And we know that treadmills produce dirty electricity. So this is very important for physicians to know, and it's very important for patients to know. And if you're electrically sensitive, you can simply test your own blood and determine whether or not the type of activity you're doing is actually beneficial. Now, we've produced, we have a peer-reviewed publication on this, and we call it type 3 diabetes. And it also, there is something called brittle diabetes. Is this a term that's familiar here? Brittle diabetes? Brittle diabetics are those diabetics who have great difficulty regulating blood sugar. And their blood sugar changes, either goes up, comes down very quickly, and it doesn't relate to diet and it doesn't relate to exercise. So I think the people who have been called brittle diabetics are actually type 3 diabetics who are responding to something in their environment. In this case, it's dirty electricity, but it could be other forms of radiation, or it could possibly be chemical toxicants in their environment as well. We found out that some people with multiple sclerosis also respond to dirty electricity. And many of you know that multiple sclerosis is a neurological disorder where the membrane surrounding the nerves in the brain becomes deficient, it malfunctions, and so it causes all sorts of problems with people. And so I began to work with people who have MS. In this particular example, we have people who have physical mobility problems, so you can see their symptoms. Depending on which part of the brain is affected, you have different symptoms. So it could affect your ability to think clearly, to remember. It could affect your speech, your ability to walk, everything. This is a young man who participated in our study. He was 27 years old at the time, and he normally walks with a cane. And what I did is I videotaped him before we installed any filters in his house. And you can see here the levels of dirty electricity. These are intermediate levels. They're high, but they're intermediate levels. Ideally, they should be less than 50 and closer to 30. So I asked him if he would walk down the hall, and this is what he looked like. You can see he staggers. And normally he would be holding on to this rail here. 2 weeks later, we went back and we videotaped him again, and this is the change. You can't tell he has MS in the second picture. Now, what happens with this young man is that when he leaves his safe home environment and he goes out into an environment that's polluted, all of his symptoms come back. And it takes him several hours of being in a clean environment before they go away again. So this is definitely, for him, it wasn't a cure. It was simply preventing his symptoms from manifesting themselves. This is another example. This is a woman who is 40 years old. She has secondary progressive multiple sclerosis. And you can see the levels of dirty electricity in her house are quite high. This came from a plasma television set. So her husband bought her a plasma TV because she couldn't do very much with her life. The levels here were as high or higher than in the school where they had cancer. And so I asked her if she would hold her hands out in front of her so I could videotape how much they moved. And this is what we got with her. 6 weeks later, we went back. We put in filters. 6 weeks later, we went back, and this is the difference. So there was no change in any of her medication during this period. This is simply an improvement in the mobility of her arms. Not everyone we tested with multiple sclerosis benefited. This is another example of a man we tested, and I couldn't tell any difference in his ability to move. So once again, we don't know what percentage of the MS Society, MS people this will help, but it will definitely help some individuals. Now, one of the things I don't have in this presentation is that when we look at MRI scans for people who have multiple sclerosis, that's one of the ways you determine where the MS is. You have lesions in the brain. And one of the things we're finding is that people who have cleaned up their home environment, after a number of years when they go back for another scan, those lesions have disappeared. So there's very positive evidence coming out of this that this could be a longer-term solution to people who have MS. The second example I'd like to give, or the third example, I guess, I'd like to give you a fourth example, is with lights. Compact fluorescent light bulbs make people who are electrically hypersensitive very ill. They always tell me that I can't be near them, I get a headache right away, I become dizzy, I become nauseous. And so we did a study where we asked people what their symptoms were with, in this case, the blue is the incandescent light bulb, and the red is the compact fluorescent light bulbs. And you can see here, these are people who are very electrically hypersensitive, but about 75% of them get a headache when they're exposed to the light bulb. So they have eye problems, migraine, fatigue, irritability. All of these symptoms are much, much higher for the compact fluorescent light bulb. They also have heart palpitations or skin problems as well. And what we did is we took a light bulb and we measured it. We wanted to find out what was coming along the wire from the light bulb and what was being generated through the air. So we measured this, and this is what we found. This is an incandescent light bulb. The dirty electricity is shown here on the wire. The more spikes there are, the more dirty electricity there is, and this is showing the radiation coming through the air. Now, this scope reading is the same whether that light bulb is turned off or whether it's turned on. This bulb is not producing any dirty electricity or radiation in the frequency range we were testing. This is a compact fluorescent light bulb. So you can see here that the levels of radiation are much higher both on the wire and through the air. And this is called dirty electricity. When we measured it using the special meter, it went from 65 up to 300 units. So people who are electrically sensitive, who have these light bulbs in their home, it's making them sick and they have to remove them. There was a TV program in Toronto where the reporters went out and they told the audience about dirty electricity and light bulbs. And they recommended that if you think you're electrically sensitive and you're reacting to the light bulbs, simply unscrew them for a week and see if any of your symptoms go away. They had the more people calling that program than any other program they did. So many people were calling in and saying, my headache's gone, my back pain's gone, I'm sleeping better. It was really amazing. So they ended up doing 4 different sessions on this issue, and a lot of that is available on the internet if anyone's interested in following up with it. And this is how some people react to these light bulbs. This is the woman in the United Kingdom, and she developed a skin rash, a very severe skin rash, following 20 minutes exposure to a compact fluorescent light bulb. In the United Kingdom, there are 3 different organizations who say that these light bulbs are making their patients sick. One is the British Dermatological Association, one is Migraine Action, and the other is Epilepsy Action. So people who have epileptic fits, some of them react adversely to the frequencies from these light bulbs. The good news is that we can take one of these light bulbs, we can filter the dirty electricity, and this is what happens. And this happens instantly, so we can measure it very quickly. It's not a placebo type of reaction. And the level of dirty electricity in this case dropped by a factor of 10 from 300 down to close to 30 units. Now this is the electromagnetic spectrum, and here we have ionizing radiation that I don't think anyone would deny that it's harmful. I think everyone recognizes that if you're exposed to X-rays or ultraviolet radiation for a long period of time, then you're going to develop symptoms. Then we have a part of the spectrum that's called non-ionizing radiation. And within that, we have given different names to different parts of the spectrum. There's extremely low frequency down here. A lot of research has been done on that, and that's been associated with things like childhood leukemia for exposure in the home. There's a range called radio frequency that overlaps with microwaves. Then we have infrared and visible light. And the dirty electricity that I'm referring to is within this part of the electromagnetic spectrum. The World Health Organization refers to this as intermediate frequencies. The other part of the spectrum that's also very important and something that we're exposed to more and more is microwave radiation from a lot of the wireless technology that we're using. So that fits in this part of the spectrum. And together, all of these different types of exposures are referred to as electrosmog, which is a play on air pollution, which is another form of smog. We can be exposed to this through the air, through the ground, and through wires. And if we're talking about microwave radiation, one of the things we know about microwave radiation is that it can penetrate walls. That's one of the reasons we can use our cell phones inside the building, even though the antenna is outside the building. We also know that microwave radiation can be reflected by metal objects. So here we have a metal filing cabinet, and that can either increase or decrease your exposure depending on where you are compared to the filing cabinet compared to the source of radiation. And if you're in a room where there is a lot of metal objects and you turn on your microwave oven, for example, or you have other source of microwave radiation, then basically what you're doing is this is bouncing off all sorts of things in that environment. The bedroom, we know, is one of the most important rooms in your home because that's an important time when your body's actually regenerating. Having a metal bed frame or even metal springs in your bed will cause the metal to reflect the radiation. And so you can be exposed to higher levels just because of the metal around you. If you remove the metal, then you're exposed to much lower levels. Now, we know that microwave radiation is absorbed by water and fat. That's why we can put things in a microwave oven. Every single microwave oven except one that I've tested leaks microwaves. And so standing in front of an oven while your food is going around is probably one of the worst things that you can do. And there's a way of finding out if your microwave oven leaks. If you have a cell phone that you can use in your kitchen, if you can call it and it rings, so you have reception in your kitchen, and you take that phone and put it inside your microwave oven, okay, you close the door, but don't turn your microwave on. What you should do instead is you phone it. And if your phone rings inside your oven, it means the radiation was able to penetrate through, okay? So that's one of the ways that you can tell if your microwave oven leaks. Now, there are a number of different sources of high frequency, radio frequency, and microwave radiation. They come from cell towers, they come from your cell phone, Bluetooth, your cordless phone that's in your home, even wireless baby monitors and Wi-Fi. These are very, very important sources in your environment. And in North America, we now have something called a smart meter that they're putting on buildings to regulate the amount of, to measure the amount of electricity you're using. They're putting it on water, they're putting it on gas pipes. And this is causing radiation. Now, if you talk to the utility, they will tell you that this actually transmits for a very short period of time during the day. And so we went out and we started measuring what some of these are doing. And you're going to hear and see how the levels change. So you can see in this example that this meter on this person's home is almost constantly radiating. And if you look at the vegetation near the meter, do you notice anything different? Okay, right here, there seems to be damage to the vegetation. And this meter is actually directing the radiation in this direction. So if it can damage vegetation, you think it would probably have effects on human health as well. I'm just going to go to another example that I wanted to show you. We actually recorded different types of equipment that you might have in your home that generates microwave radiation. And I'm going to, if this works. Let me just get to the sound. Nope, for some reason. Let me just try it again. Nope. Okay, maybe I won't be able to show it to you. I'll try again because it worked a few minutes ago, so I'll try again. But basically what we did is we recorded different sounds from these different units, and if we could hear them, if we could actually hear what we're exposed to, or if we could see what we were exposed to, we probably wouldn't want to use the technology nearly as much as we're using it today. So cell towers are a serious problem, and there have been people, scientists around the world, looking at how it affects people who live at different distances from these cell towers. And what I'd like to do is share with you just some results that are done looking at mortality from cancer. This is a new study that just came out last year. It's in Brazil, and what they looked at was the cancer deaths for people who lived at different distances from base stations, which is basically a cell phone antenna. This is the distance away from the antenna, and this is the rate of mortality per 10,000. If the towers have absolutely no effect on mortality, you would expect this blue line. So that's the null hypothesis. And I think you can see here that the closer you live to one of these antennas, the higher your risk of dying from cancer is. So anything closer than 500 meters, and this is something that has been shown over and over again, a distance of 500 meters seems to be really critical for this. Now, the highest level of radiation that they measured in this particular example is at 4% of guidelines in my country and 4% of the international guidelines. So at very, very low levels that aren't regulated properly, we're finding that there's an increase in cancer. There have been 2 other studies looking at this. One is in Germany and one is in Israel, and they're finding virtually the same thing. If you live closer than about 350 to 400 meters to a cell tower, you have a greater risk of developing cancer. The other problem with living close to these cell towers is that you have symptoms of electro-hypersensitivity, which include fatigue, chronic fatigue, sleep disturbances, headaches, feelings of discomfort. All of these different symptoms tend to increase for people who live closer to these cell towers. Collectively, these symptoms are called electro-hypersensitivity, which is similar to multiple chemical sensitivity. I prefer to call it something else. I call it rapid aging syndrome, because the way that people explain away their symptoms is they say, well, I'm getting older. This is normal for me not to be able to sleep. Because when I was younger, I could sleep. Now I can't sleep. It's normal for me not to be able to remember things. And the difference between real aging and this type of sensitivity is that when you go into a clean electromagnetic environment, you sleep well, you're not in pain, you're not tired, you can think clearly. And that's really a very important difference. Now, there's also a lot of research done on mobile phones, particularly cancer. And last year, the World Health Organization came out and classified radio frequency radiation as a possible human carcinogen. And it's based on studies like this one. This was a cell phone study conducted by Dr. Leonard Hardell, who's a Swedish oncologist. And you can see here that people who used a cell phone for more than 10 years had an increase in ipsilateral tumors, which are tumors on the same side of the head that they hold the cell phone. For a brain tumor glioma, it was a 90% increase. For acoustic neuroma, which affects the nerve going to your ear, it was a 60% increase. And for an eye cancer, uveal melanoma, it was a 320% increase, all on the same side of your head after a 10-year latency period. They also looked at how old you were when you first started using a cell phone, and if you were under the age of 20, you had a 400% increased risk of developing a tumor after a 10-year period. And there's more and more young people, unfortunately, now using their cell phones. The conclusions from the study are the current standards for exposure to microwave radiation during mobile phone use is not safe for long-term exposure and needs to be revised. There are scientists and medical doctors around the world who are asking that the current guidelines we have for microwave radiation be reduced significantly, to less than 1% of the existing guidelines. So you can imagine how high they are. We also have evidence that radiation affects sperm. In a fertility clinic, they were looking at men to find out if there was a relationship between the quality of their sperm and the amount that they used a cell phone. And what they found is that things like sperm count, sperm motility, how quickly the sperm moved, how long the sperm lived, and the shape of the sperm varied by how much you used a cell phone. So for those who did not use a cell phone, this is what you would expect. And here, for those who used a cell phone for more than 4 hours a day, there was a decrease in all of these different parameters. And we know that reproduction, infertility, is becoming a very serious problem. Some of this is due to some of the xenoestrogens we have in the environment, but some of this is actually due to radiation as well. Some of the people who are electrically sensitive tell me that they can feel their heart palpitating when they're exposed. And some of them, it's so bad that they think they're actually having a heart attack. These are the symptoms: palpitations, arrhythmia, pain or pressure in the chest, and high or low blood pressure. So it really varies. And so what we decided to do is, because it's easy to measure the heart, it's obviously, you have different ways of measuring, monitoring the heart. We took the base of a cordless phone that radiates all the time. As soon as it's plugged in, it radiates, whether you're using it or not. And we asked the question, does it affect the heart? A very simple question. The frequency of this phone was 2.4 gigahertz, which is the same frequency that's used for your microwave oven. The intensity that we're allowed to use in North America, as well as the international guidelines, are 1,000. These are the units. And our cordless phone had 3. So we were at 0.3% of the guidelines for exposure. And we exposed people for a 3-minute period. We used a heart rate variability monitor. Both the person being tested as well as the doctor who was using the radiation, or who was documenting the radiation, were blinded. And this is the kind of results that we got. This is measuring the time between heartbeats. And so something that is higher here, it means a slower heart rate. Something that is lower, it means a faster heart rate. As I mentioned, both the scientist, the doctor, and the patient were blinded, so this was a double-blind experiment. And these are the results we got. This is a subject who was exposed for 3-minute periods. And this was their heart rate for each of those periods while they're lying down. And Dr. Marangel would look at this to try to figure out when they were exposed and whether the response was positive, negative, or neutral. For this example, this was the pre-exposure, this was the exposure, and this was the sham exposure. And this person was non-responsive. There was no difference. Here's another example. Okay, you can see quite a dramatic difference. This is when they were exposed to the phone. This is their sham exposure, and this is their heartbeat. So here we have a person who's lying down. Their heartbeat is 68 beats per minute, which is a resting rate, and then suddenly it jumps up to 122. It doubles instantly. So this person is actually really very, very sensitive. And you can see it's repeatable. This is an example of tachycardia, a rapid heart rate. We also measured how it affected the parasympathetic and sympathetic nervous system. So this is another subject. This is when they were exposed. You can see there's an increase in heartbeat. And this is how it affected their sympathetic nervous system and their parasympathetic nervous system each time they were exposed. And this is the equivalent of a stress response. This is a fight or flight response. Okay, I'm just going to show you one more example. This is a subject who became progressively worse. The more we exposed them, the worse they became, as you can see here. And so we didn't have a sympathetic response or a strong parasympathetic response until the 3rd exposure. So everyone responds very, very differently to this form of radiation. This particular study is also peer-reviewed. It is the first study that documents immediate and dramatic changes in both heart rate and heart rate variability caused by an approved device that generates microwaves at levels that are well below the existing guidelines. One of the interesting things is that students now in schools are complaining of heart problems. They're complaining of palpitations, to the point where some of these students are actually taken to a cardiologist to find out if there is something wrong with their heart. This is a school in Ontario that had Wi-Fi introduced in the classroom. And this is how some of the people responded, some of the students responded to this radiation. A 6-year-old girl, musical heart. She gets headaches, she's dizzy, but only at school. A 12-year-old boy with tachycardia, or a rapid heart rate. 12-year-old girl, nausea, vomiting, no fever. She has insomnia, blurred vision, tachycardia, only at school. A 13-year-old boy, heart pounding, insomnia, headaches. They moved to a different environment and all the symptoms disappeared. And here we have what happens to some of the kids who are in schools with Wi-Fi.
Hi, I'm Austin Lamont and I'm 14 years old. I go to Mountain View School. I've been suffering weird headaches and dizziness and displacement. Like, it feels like my head is, like there's a lot of pressure in my head and it's like repulsing like this. And I just feel like displaced, and then when I'm not there, if nothing happens. So and like I get really like weak, and like it's hard to hold a pencil too, and I can't think straight.
Starting this year at Mountain View, I've been getting a lot of headaches, and it's been making me really dizzy, and like it feels like I can't concentrate, and you feel like you're not really there. It's hard to explain.
The thing that concerned us was that she always got better when she got home, and we couldn't figure out what was going on. We got her eyes checked and found out that wasn't it, and actually had everything checked and found out that wasn't it. And she's still, to this day, when she goes to class, probably about 4 out of the 5 days that she's there, she's coming home with a headache, and I mean significant headache where she has to take Tylenol or Advil.
The other type of study that we did was looking at the blood. And I didn't want to do too much on this, but I did want to show you one thing, is that I'm interested in the harmful effects of electromagnetic energy, but I'm also interested in how it can be used to heal. The research that was done in the former Soviet Union, much of the research they did was looking at therapies that could heal bones, that could get rid of depression, things of that nature, that would deal with pain. In North America, a lot of the research on microwaves and radio frequency radiation started at the other end of the spectrum. They were looking at how it affected military personnel who were exposed to radar. And so when they were setting up guidelines, the guideline was how low does it have to be before it causes serious damage to someone. Whereas in the Soviet Union, what they were looking at is these are the therapeutic effects. How high can we go before we cause damage? So we have totally different guidelines in those two countries. As a scientist, in order for me to understand the mechanisms involved, it's important to look at both sides of the spectrum. And all I would really like to do is show you two examples. Actually, I'll just show you one example. We went to places where they're doing research with this and where medical professions are actually using this as therapy to try to find out how successful they are and what it seems to work for. And one of the places we went was Liechtenstein, where they have something called a beamer technology. This is a mat that you lie on that gives you a certain frequency that's very similar to the natural frequency of the Earth. And then they document how you change. While we were there, we were introduced to the research of Dr. Rainier Klopp, who's with the Institute for Microcirculation in Berlin, and this is one of the largest institutes looking at microcirculation. The results that we saw were amazing. This is actually inside a body, looking at the flow of blood through the different vessels. And you can see here that some of the blood is very cloggy, it's not moving smoothly. This is what happens to the blood after a treatment that's about 10 minutes long. It's a very short treatment. It causes the blood to flow very easily through the blood vessel. I'm just going to show it to you again so you can watch them both at the same time. What this treatment does is it prevents the cells from sticking together, so it decreases the viscosity of the blood, and that can have all sorts of benefits for people who have heart problems, for people who have multiple sclerosis, because part of that is not enough circulation of the blood getting to the brain. The amazing part of this is what it does to white blood cells. Here we have white blood cells. This is after treatment and this is before treatment, and you can see the white blood cells are moving along the inside of the vessel here, whereas they were just speeding through. And this is a slow motion of one white blood cell that detects some contamination in your body, and it's actually squeezing through into your cells to go after the infection. Absolutely remarkable type of photography that's being done here. And one of the things they found is that exposure to this radiation, to this healing energy, is actually benefiting the body enormously. It's boosting your immune system, which will then have all sorts of benefits to your health. Basically, what we found is that there's a change in blood viscosity, there's a change in blood circulation, there's a change to your immune system. We know that this therapy has been used to heal bone fractures for a long time. It's been used for at least 50 years that I'm aware of. It's being tested currently for depression, for people who are depressed, but the pharmaceutical drugs don't seem to work. And it's used to test, it's used for treating chronic pain as well. More and more of the devices are ones, initially the devices were used only in a hospital setting, and now they're making small devices that you can take home and use in your home environment as well. These are some of the symptoms that they've been, or tests that they've been used for. And what's really important is these pulse electromagnetic field devices, they do not treat a condition. What they do is they promote your body's ability to heal itself. And I think the more research we can do on helping the body heal itself and to protect it against other types of exposure like the dirty electricity and the microwaves, I think that's really the medicine of the future. I think energy medicine is going to play a much larger role in the future than it has played so far. And I think with that, I'm just going to end the talk. So really, this talk is to a certain degree about looking at the harmful effects of electrosmog and the beneficial effects of some of the electrotherapies that are being used currently in labs around the world and in hospitals around the world. Thank you very much. Are we entertaining questions, or do you know? Does anyone know? No questions from the environment? Okay, yes? Thank you for saying that, because I didn't have a chance to mention this. The blind study is absolutely critical because you don't want it to be a psychological response. And so Dave Stetzer actually made placebo filters that they're not connected internally, so they look, feel, weigh the same as the other filters. So when we went into the second school environment, we said, this is what we're doing. We have these filters. You won't know when the real ones are in versus the placebo ones. Please just complete the daily forms regarding your health and student behavior. So there was no way that they would know whether or not real filters were in. So it was a single blind study. In this case, we didn't need a double-blind study because we weren't evaluating them, they were self-evaluating. So all we had to do was do the statistics on the results.